Hi guys, welcome to my channel. I'm Rachel, owner of Rach Beauty Bar. We are a spa located in Kingston, Jamaica, and today we're going to be talking about chemical peels, right? It's peel season and we're going to be talking about chemical peels. For dark spots, hyperpigmentation, acne scarring, chemical peels are an excellent option to treat those conditions. And in this video, I will be giving you the one-on-one essentially on chemical peels. What they are, how they work, and what you need to know before and after a chemical peel. Alright, so first things first, another phrase for chemical peels is chemoexfoliation. When persons hear chemical peel, they get a bit like apprehensive because they think it's something like super scary for your skin. But remember that water is a chemical. There's a lot of things that we use on our skin that are chemicals. So we shouldn't be scared of the word chemical, right? A chemical peel is a procedure that's done by using a chemical solution to remove layers of your skin, revealing vibrant, more fresh, healthy looking skin that lies underneath. Now, depending on the different types of peels, you have superficial peels, light, medium, and deep depth peels. However, the strength of the peel will determine how many sessions of the chemical peel that you need to do. So for superficial, light, or medium depth peels, you will have to do more. You have to do it in a series, so more than one, 2 to 3 peels or 2 to 4, depending on your specific skin condition and what we're treating. That will determine how many peels you would need. However, for the stronger medium to deep depth peels, that would require less sessions or less treatments then of the chemical peel. Now, just to, get into that from now. So, there are various chemical solutions that we can use for the chemical peels, and these range from BHAs, which are beta hydroxy acids, like your salicylic acid, to AHAs, alpha hydroxy acids, such as mandelic acid, glycolic acid, lactic acid, to perform a chemical peel. And these would typically range between a superficial to a medium depth peel, and we have on the stronger end of the spectrum more deeper depths of peels, such as trichloroacetic acid, which is a TCA peel. You have your Jesna peels, you have your phenol peels, which phenol peels would be on the more drastic or deeper end of the spectrum as it relates to depth. Now, what we are referring to when we're speaking to depth, it means literally the layers of your skin. So as you see my face now, this is what we call the epidermis, right? And when we apply things topically, it has to penetrate through the epidermis and then into the dermis. Now, the depth of the peel means how far into the layers of the skin that the chemical solution is going. Now, for higher Fitzpatrick's 4 to 6, which would be darker skin tones like myself, then firstly to preface, the deeper the peel, the closer it gets to like inside of your skin, like where your blood vessels and all of that lie, right? And that also, for deeper depth peels, then that gets so deep into the skin that it can actually affect how your body heals, how your skin heals, and that would refer to like the phenol peels. So for higher Fitzpatrick's like myself, Fitzpatrick's 4 to 6, those are the darker skin tones. We really have to be careful with the deeper depth peels. In spa, I prefer to do superficial to medium depth chemical peels on darker skin tones, and we just do it in a series because we want to avoid post-inflammatory hyperpigmentation. And the darker the skin tone, the more likely it is that you are prone to the post-inflammatory hyperpigmentation, which is darkening of your skin brought about by some form of trauma or external trauma to the skin. So the superficial peels don't penetrate further than the epidermis of your skin. The medium depth peels would penetrate through to the papillary dermis of your skin, and the super aggressive deep depth peels would penetrate all the way down to the reticular dermis of your skin. For darker skin tones, it's best to do a superficial or a medium depth peel, because for darker skin tones, anything that is more aggressive than a medium depth peel that's going to penetrate all the way down to your reticular dermis can literally cause more dark spots, more scarring, and it can affect your skin's natural mechanism to heal itself, right? Because you're penetrating all the way deep down into your skin. So for Fitzpatrick's 4 to 6, that would be darker skin tones, stick to superficial or medium depth peels. If you're a Fitzpatrick 1 to 3, which is lighter skin tones, then you can do superficial, medium, and deep depth. Now, your superficial peels would be like a salicylic acid peel, which is great for acne, and it usually has also for the superficial peels can be a low percentage of glycolic acid, like 20 to 30% perhaps, 20 to 30% or 10 to 25% glycolic acid, and these penetrate to the epidermis of your skin. So your medium depth peels would be a higher percentage of glycolic acid. Your TCA peels, your mandelic lactic acid, mandelic acid peels, these would be your medium depth peels. And for your deep aggressive peels, that would be like a phenol peel, which penetrates all the way down into your reticular dermis, and this can lead to, burning of the skin, and it can actually affect your skin's natural response to heal itself. And this is why, not in isolation, but for Fitzpatrick's 4 to 6, which would be darker skin tones like myself, we should stick to superficial and medium depth peels, because we're more prone, the darker the skin tone, the more prone you are to tanning and post-inflammatory hyperpigmentation. So we don't need to be doing a phenol peel that's more suitable for lower Fitzpatrick's, so Fitzpatrick's 1 to 3, that's lighter skin tones, and they can do lighter skin tones can do superficial, medium, and deep depth peels, right? And so in Sweet, we take a gentler approach. So I would much prefer, when I'm starting a peel client, we go in for a light peel just to kind of test the skin and see what kind of reaction we'll get from the peel. Usually 90, like most of the time, so before we even do a chemical peel, you would have to be on an at-home skincare regimen that contains multiple tyrosinase inhibitors, because we want to prep the skin. I'll also add that a Jesna peel would also fall into the medium depth spectrum of chemical peels. When you use these chemical solutions, you're triggering your skin's natural wound healing response then. So that will in turn stimulate fibroblast activity, stimulate collagen growth, which 90% of your skin, the fibers in your skin is collagen. So you have collagen and elastin. Elastin is about 1%. But yeah, so this stimulates the collagen growth and fibroblast activity, which helps to reveal that vibrant and gorgeous looking skin. Yeah, so what is a chemical peel good for, right? So there are several over-the-counter peels that you can get on Amazon, etc. But they would be not necessarily superficial peels. I guess it would be like superficial peels then, because they are the chemical solutions are at a lower concentration, because the higher the concentration, the more strict protocols and guidelines that need to be adhered to, which is why for your superficial, medium, and especially your deep depth chemical peels, you need to see a licensed esthetician or a dermatologist to perform these peels on you. A lot of the peels that we use in Sweet, we do require an active esthetician license to even purchase, and there are strict protocols that need to be adhered to, because you can damage your skin, especially for the deep depth peels. But even with the superficial or medium depth peels, there are strict protocols, meaning different peels have different neutralizing structures. So like for a salicylic acid peel, it may be self-neutralizing. So what that means essentially is when you apply the chemical solution, you would need to neutralize it to stop the activity from continuing, right? You have some peels that are self-neutralizing that you put on your skin and you don't have to remove it. And you have some that need to be neutralized. And until they are neutralized, it will still be active on your skin, right? So there are specific treatment protocols that need to be adhered to, which is why you need to consult a licensed esthetician or dermatologist to perform these. And at Rach Royalty Beauty Bar, we offer superficial and medium depth peels because, like, literally 100%, well, not 100%, but probably. I wanted to add here that there are hybrid peels, meaning it's a mix of ingredients containing like a superficial and a medium depth peel, or a medium and a deep depth peel. For example, while I don't offer solely deep depth peels such as a phenol peel, the TCA peel that I offer in Sweet does contain in that formulation a percentage of phenol. So this would be a hybrid peel. And I'm extremely strict with this. You have to use the specific products that I tell you to use in your pre and post peel regimen, and you have to maintain that consistently before I even consider you for a peel, TCA peel, because it does contain phenol. I'm located in Jamaica. 95% of our clientele would be persons with darker skin tones, Fitzpatrick's 4 to 6. So we don't need to be doing any deep depth peels. But even for the medium depth peels, which would be like a TCA or Jesna peel, you have to be on a strict at-home regimen before I will even administer a TCA peel to you, because there are just so many risk factors involved. And the integrity of your skin barrier, the integrity of your skin's health is paramount, right? So to do a peel on darker skin tones, most of the time it's going to be a peel series. So 2 to 3 or 2 to 4 peels, depending on the condition of your skin. It might be more sessions than that. And yeah, depending on what we're treating as well, because we might do chemical peels, and then after we have gotten the maximum results from these peels, and we can do microneedling. So every client is different, everybody's skin condition is different, so everybody's treatment plan then would be different. Okay, so another thing is what to do pre and post peel. Now, as I mentioned before, the different types of solutions that are used in a chemical peel. So your BHAs, your salicylic acid, your AHAs, glycolic, mandelic, lactic acid, right? These are stuff that you can use over the counter. These are stuff that you can use over the counter in your face washes. You have different, chemical exfoliants that contain these ingredients, but they're in lower percentages. However, these can prep your skin for a chemical peel. So before, and I did a video, did I? I don't think I have. I think I recorded it, but I haven't posted it, so I'll just re-record a video on hyperpigmentation, and I think I'll just do that video next. Hyperpigmentation 101. So when you're dealing with hyperpigmentation, you need to be using multiple tyrosinase inhibitors, and that starts before the peel to minimize the risk of post-inflammatory hyperpigmentation. So that means then that when I'm administering a peel on darker skin tones, just by nature of the fact that you have a darker skin tone, you're naturally prone to further dark spots then because you have done a chemical peel, right? So I want to stick a pin and just, give, So melanin is present in higher amounts in darker skin tones. And I lost my train of thought, but I'm gonna find it back. The tyrosinase inhibitors. So the aim for dark spots when you're treating hyperpigmentation is regulating the melanin production, because your skin naturally produces melanin. What we don't want is uncontrolled or this chaotic distribution of melanin in a concentrated area, and this is usually as a result of some injury. So dark spots and hyperpigmentation is not just as a result of UV damage, it's as a result of different immune irregulations, different immunity issues in the skin, physical trauma to the skin, wounds, scarring. The production of melanin is as a result of those things as well. So when we are going to wound the skin by doing a chemical peel, your body's natural result is to produce more melanin, which is, kind of ironic given that that's the thing that we're actually trying to treat with the chemical peel. And that's why before you do the peel, your pre-peel procedure has to include a tyrosinase inhibitor, so we can get before those melanin receptors and producers in your skin to, kind of tell it to dial back a bit because we're doing a treatment. So yeah, you need to prep your skin we need to hydrate the skin. We need to ensure that the skin barrier is intact before we peel, and we need to ensure that you're using some tyrosinase inhibitors before you peel as well. And again, depending on what we're treating, you will have my guidance to, if you come in spa, but you will have my or your esthetician's or dermatologist guidance as it relates to what products you need to use for your specific condition. Now, after the peel, and I'll also say again, as it relates to exfoliation, chemical peels are a form of exfoliation, as the name states. It's another phrase is chemoexfoliation. So it's not recommended or even necessary to be doing chemical peels frequently, in the sense that if you're on a treatment plan and we have outlined what we're treating and you're going to do a certain amount of peels, fine. But it's not something that's going to be in a series every 2 weeks for the rest of the year or whatever, no. It's usually, if you're doing a peel series, it's usually for a defined amount of time, and then after that you can do a peel every 2 months, every quarter, depending on your skin condition. but we have to avoid over exfoliation, because chemical peels are a deeper form of exfoliation. Then we have to be mindful of not overdoing it as it relates to the chemical peels. Now on to post-peel protocol. You need to treat your skin like a brand new baby. You need to be mindful of the sun exposure, what you're putting on the skin, like all of those stuff. So after you peel, you need to pause your actives for probably about a week, like your retinol, all exfoliating acids, because you have removed that protective layer from the skin, right? So you need to ensure that you're wearing your sunscreen. A mineral sunscreen is preferred, especially for those with sensitive skin types, because the chemical sunscreens, you might feel like a tingling or a burning on your skin. So just avoid the problems, please, and get a mineral sunscreen. Use your sunscreen, hydrate your skin, use a very gentle cleanser for like a week post peel, and eliminate retinol, your salicylic acid, your AHAs and BHAs, all actives from your routine for that week. For a week after your chemical peel, you're focusing on hydrating your skin, ensuring that it's properly moisturized, and wearing your sunscreen. If you have done a medium depth peel and you have a darker skin tone, or just for everybody in general, but especially if you have a darker skin tone, be extra. If you can wear a visor, if you're going out on the road, wear it. Usually, if you can schedule your peel, so for a time when you're home, so on the weekend, especially for the like 3 to 5 thereabouts of your peel, after your peel, which is when you would typically see some peeling depending on the depth of the peel, or some flaking. Yeah, you can schedule that. Wear your visors, wear your sunscreen. If the type of peel that you have done is a deeper depth and it causes your skin to flake or peel, you have to ensure that you do not pick your skin, do not pick off the flakes, because this can lead to scarring. And the whole purpose of the peel, the whole purpose of the peel in the first place was to get rid of the acne scarring and the dark spots. So don't pick your skin. Now there are different types of peels. For the superficial peel, it usually doesn't cause any of the flaking or peeling of the skin. And another thing I must also add is, across the board, depending on your skin type, you may not experience that flaking and that actual peeling effect of the skin. Not everybody experiences that. And depending on the type of peel, it won't cause that visible peeling or flaking of the skin. But that does not mean that your peel is not effective. Some persons will experience that peeling literally beneath the surface of the skin, so you're still getting the results, and you will see the results visibly of the chemical peel without witnessing that visible peeling or flaking of the skin. So that's also something to note. Yeah. The type of peels that I use in Sweet are the type of peels that give you almost like a no downtime effect. So yeah, it usually gives you like a no downtime effect. What you usually expect after your peel is sometimes a bit of dryness, which you can moisturize your skin. You might see flakiness. And of course you'll be protecting and hydrating your skin. Now, depending on the skin condition that we're treating, I may do multiple layers of a peel, which is what I would call a customized peel. So if you look on our website, you'll see a glycolic acid peel, or a vitamin C peel, or something to that effect, a lactic acid peel, TCA peel, etc. However, depending on those, again, you might, typically it's a no long time peel, but I'm not going to say 100% because you can also experience peeling or flaking from those peels. However, if I'm doing a customized peel, you come in for, your consultation, I say, okay, I might do a vitamin C peel with some mandelic acid, lactic acid. I might do, it's not just glycolic acid peel, it's a mixture of various chemical solutions in one peel that would be tailored to your skin condition, right? Then, because I'm doing multiple layers of the peel, and not just multiple layers, but there are multiple chemical solutions, one, and I'm not just doing one pass, so I'm doing multiple layers. So I go in one time with the peel, and then I go in again. That's what I mean by multiple layers. That would create a more, I guess, potent or condition on your skin that can lead to that visible peeling and the flaking. I think I've covered the bulk of the details that relates to a chemical peel. If you have any questions, feel free to comment down below and I'll respond to them. Yeah, that's it. Thank you so much for watching. Be sure to like, comment, share, and subscribe. And if you have any suggestions or concerns, questions, suggestions for future videos, comment down below and I'll be happy to hear from you. Alright, bye.